Hello, I'm Charles Cha. I'm the Chief of Surgical Oncology for Hartford Healthcare, Fairfield Region at St. Vincent's Medical Center, as well as Director of Surgical Oncology for the Cancer Institute in Fairfield Region as well. I think the single most important factor of me becoming an oncologist was my experiences at a very formative age back in college, where I worked at Memorial Sloan Kettering Cancer Center. And during that time, it really opened up my eyes in terms of dealing with the treatment of cancer patients as well as surgical oncology in general, and it was something that I just really fell in love with. I think in this day and age, you cannot take care of cancer patients without having a team or a multidisciplinary group that all works together to help that individual patient with cancer. I think from a practical standpoint, we have access to enormous resources from Memorial Sloan Kettering, including clinical trials, as well as access to world experts. And so we have a multidisciplinary team where we have medical oncologists, radiation oncologists, radiologists, surgeons, a whole slew of pathologists who all work together and follow institutional as well as national guidelines, as well as individualizing the care from those guidelines to specific patients to try to come up with the best plan for every single patient. The disease management team comes up with the guidelines, and the tumor boards are actually where we discuss individual patients and how to apply those guidelines to those individual patients, because not everybody fits in one specific box. We review the imaging, we review the pathology, and we have a number of experts in the field discussing what their opinion is and what ought to be done, as well as discussing the possible clinical trials that are available that that patient might participate in. So my overall focus is sort of the clinical mission coming first, and the education and research are there to support it to make sure that we are giving every single patient the best possible care. Whenever we have a patient referred to us, we like to think of that patient as becoming part of our family. And also, I know that that's how referring providers think of their patients as well, and they want to know what's going on. What I would say to patients is that their care and getting the optimal care is our number one goal for them. I wanted to make it the best of all worlds. World-class care in an accessible, inviting environment. Outside of medicine, I love to actually cook. I'm kind of a foodie. I love to go out to restaurants. I am an avid skier, so a lot of winter sports as well as summer sports, and I just like to stay active.